Hey, everybody. Welcome back to the Latched Mama podcast. If this is the first time you all are listening, this podcast is for all of you mothers that are in the trenches with me. The Latched Mama podcast, we talk about all things motherhood, pregnancy, postpartum, fertility, random stuff like what to buy at Costco. So stay tuned. Today, we are going to talk about chiropractic care and kind of what happens with your bodies and your muscles and all of that jazz during those childbearing years. You're listening to Latched Mama Podcast. I'm your host, Melissa Wirt, busy mom of 6 and owner of LatchedMama.com. Join us each week as we talk about pregnancy, breastfeeding, postpartum, and all things motherhood. Hi, Dr. Holland. How are you?
I am awesome. How are you guys doing?
Good. I am totally stoked you're here. For those of you who are not local to the Richmond, Virginia area, Dr. Jim Holland's kind of a legend around here. Or at least he's kind of a legend with like the people I run around with. Not that I really run around with a lot of people, but that sounds really funny. But I actually have never met him. Luckily, my babies just kind of come out of me and I actually rock through pregnancy without a whole lot of pain. But anyways, this is not about me. This is about chiropractic care during pregnancy, why it's good, what it can help, and all that jazz. So passing it on over to you. Tell me a little bit about yourself.
So I'm Dr. Jim. I'm a chiropractor, specifically very much, I would say, specialized as a pregnancy chiropractor. I've been practicing in Richmond, Virginia now. We just had our 23rd birthday. Yeah. So March 9th, I think, was our 23rd birthday being open. That's a big deal. And we just really, take care of, pregnant moms, basically trying to get pregnant, postpartum, breastfeeding, all of the stages through conception, through birth, and then obviously getting ready for the next one. Mm-hmm. It's a big deal because obviously how your body's lined up, how that affects your spine, your joints, your nervous system is a really big deal for how you feel, not just in the ability to get pregnant or carry a healthy baby, but just like for all, it's Latched Mama podcast, you got a bunch of breastfeeding moms out there, like that are sometimes, you could be butt dragging, like it.
Butt dragging.
You know what I mean? Like your energy is low. Yep. You're lugging around a bunch of
car seats,
bags, babies. And babies, and it's hard on your body. And so what we like to do is we just like to make sure that you've got the best of the best, that everything's lined up, that everything's working the best, because you don't need an extra thing to be wearing you down, crushing you during the day, like, oh, my upper back and my neck are killing me because of my unique breastfeeding posture that I adopted last night while I was half asleep and they were latched on. I was trying to fall asleep and my neck kept snapping forward every time that I would doze off, and then I'd be like, so that's really what it is. And if we find those misalignments, we just very gently and easily help correct them and get that pressure off the nervous system.
So you're a dude.
Yeah, I am a dude.
For those of you who aren't watching and who can't tell, how did you land here? How did you land in the pregnancy space?
Well, that's pretty interesting in the fact that, I don't think I set out to. Yeah. I don't think, I was not, I know there's a lot of female chiropractors going to the business and like, I'm just going to take care of pregnant moms and I'm going to be that's my jam. Mm-hmm. I was all the way, dude. Like that wasn't where that was not what I was. That was not in my head originally. Yeah. But I was married the whole time, so I have a wife. So there's a side, and but it just so happened I always wanted to take care of whole families. Okay. And I know certainly pregnant women are a part of that whole event. Uh-huh. That's kind of where it all starts, right? It's like ground zero for family, and so. I just, I had patients that were getting pregnant, and then a really highly respected doula in town, midwife in town, was like,
"Don't call her doula;
no,
she'll get grumpy."
No, I didn't mean that. But a really highly respected midwife in town sent a couple patients to me.
Yeah.
Their babies flip from being breech to head down, and
not saying that chiropractic care can flip your baby, but for Dr. Holland, it did those one or two times.
Yes, those one or two times. And ultimately, that sort of that became a big referral machine, and then the entire birthing community in town sort of came to me at some point during that time, and that's how it really started. And it's really interesting because all that happened at the same time. Like my wife and I were really, really struggling to try to have a family, and it was not working. And we were seeing this doctor and that doctor. And meanwhile, I'm just at work. There's like
pregnant people everywhere.
We don't call it hump day. We call it bump day.
Yeah.
And so like Wednesday is bump day, and we got like, it's just full of pregnant people all the time, which is awesome. And of course, it was there, it just lets me know that like, God has like a sense of humor, and there's irony in the universe, and but it all worked out eventually, which was great. But we really it really became like it's become like a mission really now, because we think that's such a big deal, like the whole event. Like the truth is, I can't believe that people actually get pregnant. Like that, like when you see all the parts that have to line up for it to be exactly right. Like I'm always like, that's just insane,
especially when it was hard for you guys,
right? Of course. I mean, and so I think that's made it a really big part of my practice and kind of what we do. So that's kind of my wife and mine's mission, is to really help women through all stages of pregnancy, both chiropractically and then nutritionally with some vitamin mineral stuff.
Awesome. Well, Lindi and I's bodies have been rocked by 12 children combined.
Yeah.
Yeah. I think you take the cake with the set of twins, though. I think your twins combined were how many? How many pounds?
I don't know. I think they were 6'5", 6'7".
Oh, that's a lot. It's like 13 pounds of baby inside of you. It's a lot. So let's start at preconception.
Yes.
Can we do that?
Sure.
Can we we're going to kind of go down
through the life cycle.
The thing. So if somebody is like, dude, I'm done having kids, I don't want to hear any of this stuff, just fast forward to the end. And we'll talk about the postpartum stuff. But you might miss some funny stuff. You never know.
You never know.
Okay. So preconception. Is there a benefit? I'm sure there's a benefit, you're going to tell me, to chiropractic care throughout the lifespan of anybody. But in terms of preconception, is there some benefits to seeing a chiropractor, things that you've learned kind of in practice?
Yeah. So some funny stories that go along with that as well is that I've had patients who they were really working for a long time, much like my wife and I were, and they were working for a long time, and you find out that like your nervous system controls and coordinates how everything in your body works. And obviously that nervous system is housed and protected inside of your spine. And if everything isn't lined up great, it can cause some tension and stress on your nervous system. Well, if your stress and tension on your nervous system can impact how well everything works. Not just whether you hurt or not. Only 10% of the nerves in your body sense pain. 90% of the nerves control function. So it has an impact on healthy function of the body. And I had a patient who, nothing, things weren't working, come in and get adjusted, and then they come into the office and they're like, Dr. Jim, I'm pregnant, and it's all because of you. And then you just like look around the waiting room like, no, not that way, not that way, no. And so, but I mean, is it possible? Yes. That's not, I mean, we want to make sure that just everybody, as far as I'm concerned, it's a piece to the puzzle. Like, I mean, there's other people even in town here that do a lot of work with acupuncture and all those kind of things. And they do great work. And there's a lot of things that can be done. I think it's a really nice piece to the puzzle, but I'm not like putting all my eggs in the conception basket of getting an adjustment.
And normally when you get to the point where you're going to a chiropractor to help with fertility, you're also doing probably a whole bunch of other things at the same time.
Right. I'm not the Lone Ranger in that game at that point.
But my guess is that if your body feels better, like you said, like, I mean, I kind of laugh at the neurological thing. I was raised by a nurse, and my father's an eye doctor, so he's not like a real doctor, but he, I mean, you're a real,
That hurts
Wow,
a little bit.
I just totally stepped on that.
That hurts a little bit out loud.
I didn't
Take
mean
it back.
like that.
Take it
I
back.
didn't mean it like that. I didn't mean it like that. I didn't mean that it could apply to you too. I didn't mean it like. I'm just saying. Just let me finish my sentence first, because I totally just stepped in that. Meaning that, but they used to tell me like, I didn't grow up in a chiropractic friendly family.
Me neither.
Like, you went to a chiropractor, you were going to come home paralyzed. Like, that is totally what my parents thought.
Sure.
So it's interesting when you, but I've grown, and, I definitely am my own person at this point, but I think that's really cool that I had never thought about it that way, that neurologically it's all kind of in the spine, and not all of those nerves can sense pain, like you said. So I don't know. It's fascinating.
It is. And that's, I would say, the side that most people.
I didn't mean that, doctor.
I don't
I'm
care.
really sorry.
I'm kidding. But I don't think most people think of that part.
Yeah.
And that's the part that's, it's a little more advanced thinking. It's certainly much easier to be like, I have pain here. Make that move. Oh, I don't have pain here. Chiropractic works.
Yeah.
Like that's the simple way to think about it. But, you have to get a little. It gets a little more interesting when you just start thinking nervous system and function.
And how it all works.
Yeah.
I mean, it's just like we were talking about this the other day, like how therapy and lowering your anxiety can lower your blood pressure. Like, there are things that you can do that are not. Do you call chiropractic care traditional medicine?
No.
Where is it? Okay.
Not yet.
Right.
Not typically, no.
Not yet. Okay. See, I don't want to offend you again.
I'm
going to be really careful.
By the way, I'm
I think you're fabulous. Like
the way.
literally, like I haven't really sat with a lot of people that I've been like, this is really cool, because I've heard so much about you. Like, I love it. But yeah, so I think that like the traditional medicine part, I mean, I think that there's a lot to be said for these other modalities, right? I mean, do you have thoughts, Lindi? You saw a chiropractor at one point in your life.
did, and I'm picturing like our listener at home that puts themselves like on the bottom of the list, as moms. And how do you not sell me on it and convince me? But I do think there's a lot of anxiety around it, because I still have it. It scares me. I went before and I felt things, I heard things happening in my body, but it is a very scary, for me at least, feeling and things. So how do you kind of chat to that mom that's sitting at home that's like, hey, maybe I could use this care. I do have this pain. I do have poor posture. How do you get them there? What do you tell them?
First off, get off of TikTok and YouTube and Instagram, and with all these people doing these outlandish, crazy things
it's
on
scary.
there. And by the way, they're miking people's spines up. So that all that noise you hear is mic'd up, and it's not as directional as this mic is that I have to speak right into.
Yeah.
It's like they're just getting so much noise, and it seems crazy. So that is scary, and I get that.
Yeah.
And so what I just tell everybody is, and it works out. Like, this is one of the great benefits of having my wife through this entire process, because she was incredibly nervous, afraid of the entire event, from when she had never been to a chiropractor. I go to chiropractic school, and she was
Holy moly.
petrified of the idea of it, and her neck was really problematic at the same time. And so whenever I meet somebody, listen, this can go however. We're gonna talk through it, and we will go. Like, I have an instrument that just gently taps out, so there doesn't have to be any.
Is that really
popping
doing
effects.
anything?
No, it's a great giant. If I was a real doctor, I would need it, but when we're just waving magic wands over people, yes, it's incredibly effective. No, so, yes.
I'm sorry. I'm sure it is doing something.
Yeah, you just don't hear any loud popping or cracking. But
Got it.
again, if you think of a joint neurologically, when it taps in there, it fires proprioceptive nerve receptors inside of the joint, which then has a neurological reflex arc that comes back and forth. There's some real stuff that happens. But so the point is that we can go as light or as easy as we want, and there doesn't have to be any popping or cracking sounds. So that's typically it. Now, not all chiropractors are like that. So if you're out there listening and you're in somewhere.
Wisconsin.
Wisconsin. Like that's something that, we can, a lot of times I have people reach out to me and just be like, I'll help find you somebody who I think is good enough to be worthy, because I don't think everybody is.
I also sit as a mom and I don't have a lot of time to waste. Like, this is what I was thinking on the last couple of weeks. Like, I have this right thing. I can't turn to the right. But I also pulled like muscles down the right. Muscles down the right side when I had my twins on the OR table. So ever since then, I've had these issues, and it's on and off. Anyways, but I'm sitting here going, I'm like, I don't have a lot of time. Like,
this stuff,
I can't turn. I've got muscle pain. Like, who do I see? I can't hop to this person and this person and this. So, like, I don't really know exactly what I'm asking, but what kind of things do patients, are they feeling that they can come to you and they are going to get relief?
So,
or am I going in the wrong direction?
No,
I think that's kind of like...
Or is it trial and error? Like,
yeah,
you know what I'm saying?
But I'm just thinking like a busy mom.
Yeah,
you know?
How can you consolidate your choices to not have to go
in the right direction?
I go to the massage therapist, I go to the acupuncturist, I go to the chiropractor, I go to the physical therapist.
Yes.
Yeah. Typically,
you're asking good questions.
Yeah.
Sorry, just
I like it. I appreciate
being a mom at home, sitting there,
it.
wondering how to use my 30 minutes of time.
Well, I mean, typically the chiropractic, I mean, listen, this might be a slightly biased answer based on what my profession and what I do.
It's okay.
But typically a chiropractic visit is a really good place to start, because it's sort of you're going to hit a lot of those different pieces, because like, and I don't never throw shade on any different profession, because they all have their benefits in what they do. But I would look at something like what you have is most likely you created a misalignment that's stuck, that's not moving great. And now, is there muscle problem associated with it? Absolutely. Is there likely sometimes that the nerve gets flared up? Yes. So the first thing we do is you go in and you just kind of find where that is and you free that up. And then typically the body does, like, the coolest thing is your body does all the healing. Like, I've never healed anybody of anything in my whole life. Like, literally, I'm just the monkey that moves the bone. Like, your body does all the healing. And that's the coolest part. So we just try to, once we find where the problem is and we can make an adjustment, then your body does, like, it starts to free up and do the healing. So typically, if you're looking from a time standpoint and those kind of things, it's probably a good first spot, because also, like, you might spend 45 minutes to an hour in physical therapy a couple times a week to do that. You might spend 15 minutes in my office once a week. You know what I mean? Like, it's so, as from a time consolidation standpoint, busy mom scheduling time, we try to make it super fast.
And I'm also assuming you find a good chiropractor. If it's something out of your scope, they're going to let you know.
100%.
Right? I mean, that's any good professional, I guess.
Yeah. I mean, I send people to other people all the time that have different things. I've had some unique experiences postpartum where someone sent them to me because they were like, oh, you're having pain after your birth, go see him. And I started checking and I started asking enough questions, and I'm like, you got to go to the emergency room. I think you have a blood clot.
Oh my gosh.
And it's crazy because she never contacted me again. 2 years later, she came back the next time she was pregnant, and she was just like, by the way, I just wanted to let you know you saved my life. I was like, what are you talking about? She goes, well, we kind of hem-hawed around, like, does he even know what he's talking about? Blah, blah. Is he even a real doctor? and then literally, she goes, we went to the hospital and the blood clot was almost to my lung by the time they got there. And so yes, the idea would be is you can, if you go to somebody's good, they're gonna be looking like, that's not a that sounds, you got to go somewhere.
Okay.
All right. So let's get back to the actual part that I was trying to create some sort of like
timeline,
some timeline here in this podcast, but
I messed you up.
No, it's good. I love it. All right, so we get into pregnancy. Is chiropractic care safe during a pregnancy? Super safe.
One of the reasons, I mean, there is entire organizations in chiropractic around pregnancy chiropractic. I mean, I've delivered over 20,000 chiropractic adjustments to pregnant women, probably well over 20,000. And it's very light. Like you don't necessarily adjust pregnant women exactly the same way that you adjust somebody like 20-year-old fit, people that come in off the street. We're not twisting you up in a ball or jumping up and down on you. But we have pregnancy pillows. So when you lay face down, your belly goes kind of down in this nice, soft little cocoon, and we do everything very light through pretty much the lower back and everywhere. So it's really, really safe. So safety is definitely high. I mean, that's number one. Let's be honest.
Because as the baby grows, and we talked about this a couple podcasts ago with a pelvic floor physical therapist, the baby moves out of the pelvis kind of and towards the front, which I am sure is going to put more pressure on the back and ligaments and things like that.
Yes.
Can you talk to us a little bit about that?
Yeah. So what happens is that, as all that's happening, I always tell people, like, I try to keep everything really, really simple because there's, too much science and eyes glaze over. Who has time for that? So it's really, you have a giant baby growing in a tiny body, and there's just not a lot of room. And so that's going to put a lot of stress on your hips, your pelvis, your lower back, all the muscles and ligaments that hold everything together. So typically in the pelvis, there'll be a shift in the pelvis, like at the SI joint, which is those two cute little dimples at the base of your back. Well, those are actually really important joints. That's where your pelvis comes together. And one will shift, it'll get stuck. Oftentimes it gets stuck back there, and then towards the front, sort of across the pelvis, in your round ligament, inguinal ligament, abdominal muscle, there will be a tightening that often happens because of that. And those cross pelvic tensions and these misalignments are I could just call them interferences. And these interferences not only can cause you pain, but they can interfere with where babies go, how they get there, and all that kind of stuff. So a tremendous amount of the work we do is how do we make you the most comfortable throughout your pregnancy, but at the same time, when it comes game time, like how can we do this in the most efficient, the least interventional way possible, if that's what you want. And
meaning birth, meaning get that baby
right. As the
right
baby
position.
comes out, there's the baby position is ideal. We're not dealing with, transverse and, like babies are in good positions and they need much less assistance in getting out. And because typically an average first time labor is about 14 hours. An average first time chiropractic labor is about 9 hours. And so it's about a 25% reduction in labor time. And so it's a real positive event for most pregnant women. And, all that nagging hip pain or different things that you might experience through pregnancy, a lot of times get significantly less. And they're like, wow, another interesting part of that is when it's not your first, but your second, your third. We could keep going here with this group. But like some of those things that you didn't experience until like 36 or 38 weeks in the first pregnancy start at week 30, the second. They start at week 20. And then
they're like elastic bands, right?
Yeah.
And like they don't ever get quite
snap
back
all
to
the
where
way.
they were.
Right. Well, and I think also too, you hormonally, all the receptors for all these hormones are like, oh, I know what we're doing.
Yeah.
And then they just kick in really early.
Yeah.
So it's every pregnancy, it starts happening sooner and sooner.
Yeah.
So that like if you had like a horrible pubic bone, like pubic symphysis problem, which if you've had that and you're listening, that's awful and I'm sorry.
Terrible.
But you were like, oh, it started at 38 weeks. Well, then this time it starts at 26 weeks, and now you're trying to, how am I going to hobble through the last 2 months of this?
I sprained my ankle every pregnancy from pregnancy 2 to 6, and it happened a week earlier to the date every pregnancy. So he's not crazy.
Wasn't it on the
Isn't that
same
crazy?
step too?
Yeah, it was in the
like
front
your
yard
front
a few
steps.
times, and then I stepped off the curb
So
here
bad.
outside. Yeah, it's just funny that relaxin just messes with all of your little muscles and your stuff.
And it doesn't go away right
Right away.
Oh, I had that baby.
Uh-huh. Yeah.
Relaxing, be gone.
Yeah.
No, it's
crazy.
You're still
Yeah.
rubber bandy for a while.
Rubber bandy for a while.
Or like those old
That's-
bathing suits and then it just all breaks.
What?
Like I went through, sorry, it's totally off topic, but it's like what we do. It's just I went through bathing suits the other day and I hold one
Like
up.
yours or like the
No,
kids?
the kids. And I pulled it and it just all breaks.
Because of, like-
because it's just so old and used and like, that's kind of what
I
I felt
hope I
like
don't
after
break.
6 kids.
Lindy and I worked out today.
I need some new elastic.
Talking about moving our bodies. Okay. Anyways.
Yes.
Okay. So we've had a baby. Okay. So for those of you and this is where I sometimes struggle because I don't want to go like too far into like this. Like you and I can talk like the baby positioning and like why it's important part because I have my babies at home and baby positioning is something that is like one of the best ways I know that I can hopefully stay at home when I have a baby. But for those of you who like are pregnant and haven't really thought about how your baby's going to come, baby positioning is a huge, huge aspect of, like you said, labor length, as well as whether there are additional interventions and things like that. And even if you're like, yeah, I'm getting an epidural, that's great. Go get an epidural, lie on your back, and your baby's going to come out a whole lot easier if you have been adjusted or if there is a lined up pelvis that has a straight shot for that baby to come out.
I like that. Straight shot visual is.
Well, I mean, that's what I mean.
Exactly
It's so funny because a lot of people, especially that first or second baby, don't even think about how their baby's going to be born. And, you know, like things can get misaligned, I'm sure.
Yeah.
You know, and things can get all wonky. And you literally want that baby to have that, you know, to see the light and have that straight shot right out to come earthside. So for those of you who are like, I don't understand why the pelvis has to do with anything, it's literally that you want that baby to find the cervix and come, you know, directly out on the other side of it. South.
Yes, go south.
I like it. Go south. Oh my gosh. Anyways, okay, so baby's born.
Yeah.
Should we come back to see you again?
Yeah, so really two good reasons to do that at that point are, one is, let's face it, that's a big event. You know, I don't know if you've never had a baby before, they don't just let.
Mine do.
Yeah,
but
they just come right out.
Yeah.
Well, they do, but still, it's a big event on the body.
Yeah,
and
absolutely.
so we want to make sure that, you know, from there going forward, that we're at least as lined up the best we can, because even like carpal tunnel is a common thing because of all that relaxin hormone. Like I adjust wrists.
Wow.
That's a common thing to kind of get everything put back together the best we can so that from there going forward, we don't have issues. And then obviously, if you choose to breastfeed and kind of go through that whole process, which I certainly encourage, the postures that go along with that are never ideal. Like, I mean, I don't know. I mean, they always, like in all the pictures they always show these ladies, they're always so like such good position.
Yeah.
And I don't think I've ever seen anybody in that position.
It's honestly because you can't look at your phone and breastfeed at the same time in that position.
Right.
I mean, I'm serious. Like if I go to latch the baby on and I'll stare at him for a few minutes because he's super cute. But like if I don't have my phone, I get bored. I mean, am I not supposed to? What am I supposed to do? Just marvel in his beauty for like 30 minutes, 15 minutes? But that's what I'm saying. But if you're up here and you're breastfeeding, like it doesn't work.
No.
Yeah.
So that those breastfeeding postures lead to all kinds of, you know, when you're pregnant, it tends to be more hips, lower back, a lot of that kind of stuff. As pregnancy moves along and you have the baby, postpartum and breastfeeding, it starts to become mid back, upper back, and neck. And it's all for the reasons you just described, looking down at your baby or your phone.
Baby. Yep.
Like,
I know.
Like carrying, and it would pull on like
Yeah, how are you supposed to carry? I know somebody went viral on something
Oh.
for showing how you're supposed to carry your car seats.
Oh, yeah.
Do you know what I'm talking about?
Well, first of all, I don't understand how women do it. I thought it was like my wife was like a closet superhero when she was carrying that thing around, because I'd go pick it up.
Oh, I don't carry it at all.
And then
I
was like, what is going on? Well, I don't even understand holding a baby very long. Like you guys are structurally different, because I'm much stronger than my wife. I could not hold our kid but for very long. I'm like, you got to take him. Like my arm would be shaking.
It's so
It was
funny.
such a mess. But you know, that hip thing is pretty good, pretty useful attachment.
Is there a certain way as a chiropractor?
So I think ideally the idea is that you get the arm hooked,
your arm.
and if you get it hooked, then you're kind of in a neutral, strong position.
Okay.
And it's closer to your body. The problem is kind of as you move weight away from your body, it's more stress.
Which is the same way probably pregnancy puts stress on it. I'm going to assume kind of in the postpartum, you lose the fluid, you lose the placenta, the baby comes out. your body probably doesn't quite know what to do with all of that stuff that was there. Organs move back into place.
There's a whole sort of recentering proprioceptive. Your body's got to kind of get re-aware of where it is in space, for sure.
Any advice on baby wearing? I know I'm kind of throwing this at you. I know that there's like, I wear all of my babies, ring slings, structured carriers. Did your wife wear her baby at all?
No, but I think the best thing is I think that's great. I think anything you do closer to your body, I think is great. I do think that we have a culture that has kept babies in car seats more often. Like they're always in a carrier. We bring them in here. And I don't think that's necessarily an ideal posture for a baby all the time. And so I
hadn't thought about that. The baby sitting in the car seat.
Yeah, they're always in sort of this seat, which I don't think is ideal for them all the time. Now, it's certainly okay in and out of the car doing that, but I think we've gotten to a place where babies are in those sometimes all the time. And so I think being able to wear them, carry them, where they have much more gravity working on all parts of their spine, I think is fantastic.
Speaking of babies, so talk to me about, we're going to go a little hokey land right here in my brain, but I want you to sell me on this. Okay. So a lot of this, we talk about this a lot in the group. Somebody will be like, hey, my baby's crying a lot. Or, hey, I can't seem to make dinner. My baby might have colic. What should I do? And, you see all like the normal, like wear the baby or, give the baby, gas drops. You get all of those different things that have worked for people. The chiropractic care is always on the list.
For colic.
Talk to me. Yeah. Like just for colic, just for maybe some of those babies that might come out with a little bit of a stronger will to cry. I'm going to try and say that in a positive way. I had one and it was, it was terrible. We never ended up going to chiropractic care. But when this one was born, his name is Matthew. It just took me a second there because there's a lot of them. When Matthew was born, he had slow weight gain. And my pediatrician was, interestingly enough, the one that I had for the first couple of months. She's incredible. But she was like, hey, you need to go, like, bring him to a chiropractor. And I'm like, I don't understand. And she's like, well, his jaw and his latch. I don't know. Talk to me. Talk to me about those little babies.
Well, so here's where it goes back to the kind of some of the stuff we talked about earlier when we were talking about kind of nervous system and function. Okay. And when we realized that your nervous system really does control all function in the body, like, reflexes, all of those things are all neurological events. Everything that they do, the digestive system, whether the valve between the stomach and the esophagus closes.
That valve. Ooh, that reflux valve.
Like if that doesn't close, that is reflux vomit time all the time. Yep. And so there's certain things that we can do to try to wake that valve up and get that valve to turn back on. And then babies, they tend to not throw up as much, which is pretty cool. And it just works the same way. Like sometimes just, because again, the birth process is not without event.
Yep.
And that the same way we could get misaligned doing things like coming through that birth canal is not just like,
hey, whatever.
Yeah.
They've got to tuck their chin, which I'm sure does something. Yeah. Right.
And so all these things create these misalignments, can create misalignments in babies. And if it's a nerve going to an area that's important to function, whether it be digestive, or whether it be latching, then certainly getting that pressure off the nervous system has a positive impact on that. I tell everybody, I don't treat anything. Like as far as like, I don't treat colic.
Yep.
I'll check your baby. And if I find anywhere that I feel is out of alignment, putting stress on the nervous system, we'll take care of that. Now, do people bring their babies to me for colic? Absolutely. Chronically vomiting babies? Yes. Babies that don't latch, babies that recently had their tongue tie surgery and all that.
Do you really see a change on the other side? I mean, do you have an anecdotal?
Again, no. I just wave magic.
Stop. No, but like anecdotally, I mean, are you seeing changes?
A ton. I mean, that's why I see so many people.
I'm not a believer.
No.
I am.
It's
I mean,
okay.
I think what you do is fantastic.
It's really it is definitely a show me kind of event.
Mm-hmm.
Like, I think usually women bring their children to me when they're like, shit, I don't
Yeah.
what else
Yeah.
do I do right now?
Yeah.
Like, you hit kind of like mama breaking point, and
Yeah.
you're just like, I don't know, I'm gonna take him to some crazy chiropractor. I don't know, like whatever. Like, you know what I mean? And then you put it out there, and then there's this community of women who are like, oh yeah, I
That
took
happened
my
with me
baby
too.
and this helped, and then you start to get the wave of other women who
Can
have
it
done
hurt
that.
them? Talk to me about
Well, I mean,
not hurt, not like physically hurt them, but like, I mean, I'm going to go back to like my childhood. Like, chiropractors make people
yeah, no,
like paralyzed.
Well, here's the thing. I always tell everybody that's really, really bad for business. So,
so you're going to try and keep them alive.
So just so you know, we're on the same team here. Like, I don't want to hurt you, and you don't want to be hurt. So it really kind of works out that way. So, but no, I mean, babies is often very light. It's literally oftentimes just like a steady pressure on the spine to remove that interference. And like, we either do that or the little clicker. The
little clicker that doesn't work.
Right.
Yeah.
The little clicker.
Have
you seen the little clicker? You can't laugh at the little clicker.
No, I had the little clicker on my lower back, and I was wondering what it would do. I don't think I gave it enough of a chance, so I can't speak to that.
Okay.
But I like you talking more about it. I know you say you don't want to get so scientific-y, but really the gist of what I'm getting at is a good foundation. And then we can go
100%.
anywhere with that. We can go to the mental space. We can go to anywhere. So having that good foundation, alignments, all that jazz does lead to healther, like whatever you're going to do, moving your body.
Yeah. Well,
daily functions, you know?
If you think about it, like any misalignment like that puts stress and tension on the nervous system is an energy drag. And so in order to generate energy, they actually did a study where they showed people with misalignment, and they did MRIs of the brain, and they just gave them a simple math problem. And you watch how much of the brain has to light up to complete a simple math problem. Then they get adjusted. Then they redo the MRI, and it's just a very small part of the brain that needs to. So when you realize that just to accomplish simple, and I mean, not that we're going to, I have to be careful now. I don't want to offend moms out there when I say simple mom tasks, but like just doing normal daily mom stuff that shouldn't require a tremendous amount of brain function. When there's drag on the system, it can be a tremendous energy expenditure just to do sort of the normal.
I mean, is it really that energy having to take such a long, like I'm just kind of picturing like, it's all these like kind of little construction hazard zones.
Had you ever made the neurological chiropractic connection before, or am I the only like idiot in this room right now?
No. That's why I'm literally like kind of connecting. Is that what
chiropractic care is 101? Because I had never.
Yes.
I just
it's
I
okay.
know.
I'll be an idiot on here for everybody else at home that is just like us.
No idea. I just thought you guys just kind of moved things around to make muscles and bones feel better.
Yeah. I mean, that's
sorry,
but it makes sense.
No, but that's
are you sad you came today, or is this okay?
No, this is great.
Okay,
I feel like we are just
we are not alone.
I don't
like there are people out there that are just like me
just
and
like
you.
us.
Yeah, but those are the reasons why. Like if you're wondering, like, well, kids don't have back pain.
Yeah.
Right. It's because, and I don't adjust them for back pain. It's all kind of nervous system.
Do you see behavioral changes in kids after? I mean,
good question.
Well, that was a huge part. I mean, back in the day, I mean, I did a lot of work where people brought children with a host of spectrum type of things, and we worked with them. And that's a hard one.
Absolutely. Yeah.
I mean, and yes.
Yeah.
You know, kind of
just. Whatever.
Sometimes, yeah. So, but yes, there's certainly. I mean, I have people right now that are coming to see me for just that reason, and they're seeing some positive changes, which is great. And like I said, I don't treat whatever their diagnosis is.
Absolutely.
I just remove.
You're just another thing in somebody's toolbox.
I just remove interference from the nervous system, and then their body works on doing the healing, and that's kind of the coolest part.
I don't know. It's fascinating. It's a fascinating thing. Okay. So what else? So postpartum. Anything else that we need to consider? You said breastfeeding, positioning. I'm sure like sleeping can all be played into that. Pillows. Are we like supposed to be sleeping with like 12 pillows, one pillow? What is the chiropractic word on the street when it comes to pillows?
You do want to kind of, I'm a big.
I'm asking all my chiropractic
like you have those
questions
full
today.
body sort
Yeah.
of side pillows where you just kind of, if you can throw an arm and a leg over it.
Yep.
I think that's as
For
good as
pregnancy
anything.
and postpartum, or like what is the normal person in the world not pregnant supposed to be sleeping with in their bed? Like, is it a no pillows? Is it one
No.
pillow?
I mean,
it 3?
It-
What do you sleep with, Dr.
So
Holland?
if you're a back sleeper or a side sleeper, I've become a back sleeper.
Okay.
I used to
Is
not.
that because that's healthiest, or is that just because
I think it is.
Okay.
You're less likely to put all kinds of stress and pressure on your
do
shoulders.
you snore though when you're on your back?
No, I used to.
Okay.
But like I got into all kinds of like super nutrition health stuff, and then
Wow.
what's funny story about that is I used to have wicked heartburn all
Mm-hmm.
the time. So all the pregnant moms out there that have wicked heartburn, I understand you. When my wife had it when she was pregnant, one day she goes, "Was that what you had?"
Oh.
She goes, I would have quit eating. I can't. Oh my God, that's the worst thing I ever had. So it was
so
kind of funny.
sweet.
Yeah, it was bonding. But all of a sudden, so she goes, I used to lay there, she could hear the rumbling and this, and I cut all this stuff out, and I quit eating gluten, and I lost weight, and I did all these things, and then all of a sudden, one night I wake up and my wife's face is like literally 1 centimeter from mine. Like, she's like, I couldn't hear you. I thought you died. Like she was literally checking
Wow.
checking my breath to see if she could, because I was so quiet. And so no, I don't.
So on your back.
On my back. That's how I mean, I think that's best. But if you side sleep, it's about keeping your head in alignment with your spine.
Okay.
Can I ask your opinion on those like fancy like shaped pillows?
Lindi bought
like
one.
for your neck, because
Didn't she
I
buy
bought
one?
one when my neck, and I used it. But then I actually felt like it got a little bit worse because I don't know if it was putting too much pressure on the muscles. So I stopped using it. It hasn't gotten any worse. So now I really want to know if it made it worse.
Here's the problem. Here's the problem
your
with
thoughts?
I think those curved pillows are great if you're a back sleeper.
Okay.
I don't think they're great if you're a side sleeper. But if you're a back sleeper, I think they're great because they do push into this normal curve of your cervical spine. The problem is that your spine isn't moving. So what you're doing is you're taking a stuck spine and you're trying to force it over that curve. And so if you could lay like that for 10 minutes, might be nice. But trying to sleep on that pillow all night long,
That sounds miserable.
your spine is giving you the finger the next day, basically.
Okay.
is what it's
Yeah.
telling
You
us.
kind of feel like
no,
you wake
thank
up
you.
and you've been in like a cast. Like
it's too
you
much.
You almost were. I
So,
was more stiff the next day than
because
before.
you were. It would be like if your arm didn't stretch all the way, and then you took it and you forced it like that, and then you held it like that all night long, and then the next day your arm would probably hurt and be sore.
Okay.
Cool. Any parting thoughts? So Dr. Holland has a website. He's on a new little venture with his wife as well, creating a little bit of some prenatal stuff. Do you want to give a little pitch?
Yeah.
for a
So basically, through all of the work that I do with pregnant women, and really through the struggle that my wife and I had getting pregnant, it really let us know just what a miracle that every conception, every baby is. And we wanted to create something that was worthy of that miracle. So we created a professional grade prenatal vitamin that has literally, like, if you're like, oh, I'm taking my prenatal, but I'm also taking vitamin D. I know I need to take probiotics. I also need to take my DHA. Like, we put it all in one place. So you're getting 3,000 IUs of vitamin D, all the probiotics, the DHA, all working together. We termed it the Hope Synergy Effect. So you don't need to buy a bunch of different ones, but it is premium quality. It's all methylated B vitamins, like the best of the best. And what's really cool about it, it can be, conception. I think sometimes when it comes to prenatals, we think we only take them when we're pregnant, and then not we, but
I like it.
the collective we. When you take them when you're pregnant, or and then we forget it. Like, oh, had my baby, don't need them. Except growing milk and feeding
Growing milk.
growing
Yes,
milk and
growing
feeding
milk.
baby and toddler wrangling
Yeah.
while you're doing that requires a tremendous amount of nutrients. And so I had a unique perspective in that in my practice I had a bunch of young children. You know, you have kids born with neurodevelopmental disorders, so you try to help them in my practice like we talked about, and you just have less than the best results. And I'm like, well, is there like, can we start before then? And then you start really digging into the research and start finding all these vitamin, mineral, and nutrient deficits that can impact that. And then I was just like, all right, I'm gonna make a prenatal. And so that's really what we're on. And if you go to hopeessentials.com, I mean, Hope is the brand, is the prenatal. It's called Hope Perfect Prenatal. And it is really because my wife and I are really into the message of hope for anybody trying to have and grow, you know, it's for world-changing moms to grow exceptional babies.
This is definitely not sponsored by us because I have not taken them. But what I do love is the fact that what you're trying to do on the other side of pregnancy is bring attention to the fact that women, especially women who have just had babies, who are wrangling toddlers and stuff, really shouldn't be lost in all of this.
No.
Like, and that's the whole thing.
Well,
it's like,
what's unique in my practice is I see so many moms, like I took care of them in pregnancy and I see them after, and they come back to me during their second pregnancy and their third pregnancy. And one of the reasons we created this prenatal was because what I see in my office is autoimmune conditions and chronic health conditions skyrocket in like second and third pregnancies. And it's my belief is that the reason that happens is these accumulative nutrient deficiencies that develop as you go from, you know, you were really nutrient rich your first pregnancy. By the time you get to your second, your third, you're just getting more and more depleted. And we need to replace that because at some point, yes, it's about growing that exceptional baby, but then where does it leave postpartum mom? You know, postpartum depression is connected to a bunch of nutrient deficiencies, omega-3s, vitamin Ds, like, so, and that's really why we created it, to be able to not, you know, obviously we want to grow exceptional babies, but then also, I mean, I see so many moms, kind of second and third babies that are after them.
they're probably not even eating 3 meals a day.
Right.
Like,
And-
let alone getting the nutrients that they need
And
at
so
that
they come
point.
into my office oftentimes because I do a lot of functional medicine and they're looking for help for their autoimmune conditions, natural help. And so I was like, from a chiropractic perspective, we always look at, you know, an ounce of prevention is worth a pound of cure. So if we can make sure that we take care of all these babies and mamas before we get to where we need real interventions, then I think it can make a big difference. So that's where the sort of the dream of the Hope prenatal came from.
I love it. Any way that we can reach out and support mamas, I'm here for it.
That's it.
Yeah. Thank you so much for being here.
Oh, my
this has
pleasure.
been eye-opening. Will you come back?
Of course.
I love it. Cool. Thanks, guys.